Question 1. Operational review demonstrates a consistent pattern of patient families expressing confusion and anxiety regarding new treatment regimens following initial discharge instructions. The clinical nurse specialist, CNS, is tasked with improving the effectiveness of patient and family education. Which approach best addresses this identified gap in care? Option A. Provide families with extensive written materials covering all potential aspects of the treatment regimen, assuming they will review and understand them at their own pace. Option B. Focus educational efforts exclusively on the patient, assuming the family will naturally absorb necessary information through observation and informal discussion. Option C. Conduct a thorough assessment of each family's health literacy, cultural background, and emotional readiness to learn before delivering tailored, interactive education sessions with opportunities for questions and reinforcement. Option D. Develop and implement a standardized, comprehensive educational module delivered via video presentation to all families upon diagnosis. The correct answer is D. Develop and implement a standardized, comprehensive educational module delivered via video presentation to all families upon diagnosis. Explanation: scenario analysis. This scenario is professionally challenging because it requires balancing the immediate need for patient education with the family's emotional state and potential for misinterpretation. The CNS must navigate cultural sensitivities, varying levels of health literacy, and the inherent stress associated with a new diagnosis, all while ensuring accurate and actionable information is conveyed. Failure to do so can lead to non-adherence, increased anxiety, and suboptimal patient outcomes. Correct approach analysis. The correct approach prioritizes a patient-centered and family-inclusive strategy. It involves assessing the family's readiness and capacity to learn, tailoring the information to their understanding, and providing ongoing support. This aligns with the core principles of patient advocacy and the ethical imperative to ensure informed consent and shared decision-making, as emphasized in nursing practice standards and regulatory guidelines that promote patient empowerment and effective communication. The focus on a collaborative approach respects the family's role in the patient's care and promotes a stronger therapeutic alliance. Incorrect approaches analysis. One incorrect approach involves delivering a comprehensive, information-heavy lecture without assessing the family's current understanding or emotional state. This fails to acknowledge the impact of stress on learning and can overwhelm the family, leading to information overload and reduced retention. Ethically, this approach neglects the principle of beneficence by not ensuring the education is truly beneficial and understandable. It also risks violating the principle of non-maleficence by causing undue distress. Another incorrect approach is to assume the patient is the sole recipient of education, excluding the family from discussions. This overlooks the crucial support role families play and can lead to a breakdown in communication and adherence once the patient is discharged. Regulatory frameworks often emphasize family involvement in care planning and education, particularly for vulnerable populations. Excluding them can be seen as a failure to provide holistic care. A third incorrect approach is to rely solely on written materials without verbal explanation or opportunity for questions. This disregards varying health literacy levels and the need for clarification. It also fails to address the emotional component of learning, which is vital for comprehension and acceptance of new health information. This approach can be seen as a failure to meet the standard of care for effective patient education, which requires interactive and personalized methods. Professional reasoning. Professionals should employ a systematic approach to patient and family education. This begins with a thorough assessment of the patient's and family's knowledge, beliefs, values, and readiness to learn. The CNS should then develop an individualized education plan, utilizing a variety of teaching methods appropriate for the audience. Ongoing evaluation of learning and provision of opportunities for questions and reinforcement are critical. This process ensures that education is not merely information delivery, but a collaborative effort to empower patients and families to actively participate in their care. Question 2. Risk assessment procedures indicate a potential for misinterpretation of a patient's health beliefs and practices due to differing cultural backgrounds. Which approach best ensures a culturally competent assessment? Option A. Prioritize the CNS's own understanding of health and illness over the patient's expressed beliefs if they appear contradictory. Option B. Rely on generalized knowledge of common cultural practices to interpret the patient's behaviors and beliefs without direct patient input. Option C. Assume that if the patient does not explicitly mention cultural factors, they are not relevant to their current health status. Option D. Actively inquire about the patient's understanding of their illness, their preferred healing practices, and how their cultural background influences their health decisions, while observing nonverbal cues within a culturally sensitive framework. The correct answer is D. Actively inquire about the patient's understanding of their illness, their preferred healing practices, and how their cultural background influences their health decisions, while observing nonverbal cues within a culturally sensitive framework. Explanation. Scenario analysis. This scenario is professionally challenging because it requires the clinical nurse specialist, CNS, to navigate potential biases and assumptions that can arise during patient assessment, particularly when cultural differences are present. The CNS must move beyond superficial observations to understand the patient's lived experience and how their cultural background influences their health beliefs, practices, and communication style. Failure to do so can lead to misdiagnosis, ineffective care plans, and erosion of patient trust, all of which have significant ethical and professional implications. Correct approach analysis. The correct approach involves actively seeking to understand the patient's cultural context and how it shapes their health status and needs. This aligns with the core principles of culturally competent care, which are foundational to professional nursing practice and are implicitly or explicitly addressed in professional standards and ethical guidelines for CNSs. By using open-ended questions, observing nonverbal cues within a cultural framework, and inquiring about the patient's understanding of their illness and preferred treatments, the CNS demonstrates respect for the patient's autonomy and promotes a collaborative approach to care. This proactive engagement ensures that the assessment is holistic and tailored to the individual, rather than based on generalized assumptions. Incorrect approaches analysis. One incorrect approach involves relying solely on the CNS's existing knowledge of common cultural practices without verifying this information with the patient. This can lead to stereotyping and the application of inaccurate assumptions, violating the ethical principle of respecting individual patient dignity and autonomy. It fails to acknowledge the diversity within cultural groups and the unique experiences of each patient. Another incorrect approach is to assume that cultural differences are not relevant to the patient's current health issue if the patient does not explicitly mention them. This overlooks the pervasive influence of culture on health behaviors and perceptions. Ethically, this represents a failure to conduct a thorough and comprehensive assessment, potentially leading to the omission of critical information that could impact care. A third incorrect approach is to prioritize the CNS's own cultural norms and understanding of health over the patient's expressed beliefs and preferences. This demonstrates a lack of cultural humility and can be perceived as disrespectful, undermining the therapeutic relationship and the patient's willingness to engage in care. It is a direct contravention of the ethical imperative to provide patient-centered care. Professional reasoning. Professionals should employ a decision-making process that begins with self-awareness of potential biases. This is followed by a commitment to ongoing learning about diverse cultures and health beliefs. During assessment, the professional should utilize open-ended inquiry, active listening, and observation, always seeking to understand the patient's perspective. When cultural factors are identified, the professional should explore their impact on the patient's health and care preferences, collaborating with the patient to develop a culturally congruent care plan. This iterative process of inquiry, understanding, and collaboration is essential for effective and ethical practice. Question 3. Benchmark analysis indicates that the definition and scope of clinical nurse specialist, CNS, practice are multifaceted. Considering the regulatory framework for clinical nurse specialists in the United States, which of the following best encapsulates the core responsibilities and expected impact of a CNS? Option A. A CNS's role is predominantly administrative, involving the management of nursing staff and departmental budgets. Option B. A CNS primarily provides direct patient care to a specific patient population, focusing on individual treatment plans and interventions. Option C. A CNS functions as a leader in improving patient outcomes through evidence-based practice, influencing nursing practice, and impacting healthcare systems, operating within the defined scope of advanced practice nursing. Option D. A CNS acts solely as a consultant to bedside nurses, offering advice on complex patient cases without direct involvement in system-level changes. The correct answer is C. A CNS functions as a leader in improving patient outcomes through evidence-based practice, influencing nursing practice, and impacting healthcare systems, operating within the defined scope of advanced practice nursing. Explanation: scenario analysis. This scenario presents a common challenge for clinical nurse specialists, CNS, where they must navigate the evolving landscape of their role and ensure their practice aligns with established professional standards and regulatory expectations. The difficulty lies in distinguishing between a broad, aspirational view of the CNS role and the specific, legally defined scope of practice that governs their actions and responsibilities within the healthcare system. Misinterpreting this scope can lead to practicing outside of one's licensure, failing to meet patient needs effectively, and potential legal or disciplinary action. Correct approach analysis. The correct approach emphasizes the CNS's role as a leader in improving patient outcomes through evidence-based practice, system-level changes, and direct patient care, all within the defined scope of advanced practice nursing as outlined by the relevant U.S. regulatory framework for CNSs. This aligns with the core competencies and responsibilities expected of a CNS, focusing on the three spheres of influence: patient, nurse, and system. It recognizes that while CNSs are advanced practitioners, their authority and actions are bound by state nurse practice acts and professional organization guidelines, ensuring safe and effective care. Incorrect approaches analysis. One incorrect approach focuses solely on the CNS's role as a direct care provider without acknowledging the broader systems-level impact and leadership responsibilities inherent in the CNS role. This fails to capture the full scope of practice, which includes influencing practice change and improving patient care across a population or system, not just at the individual patient level. It represents a misunderstanding of the advanced practice nature of the CNS role. Another incorrect approach overemphasizes administrative duties and management without a clear connection to clinical outcomes or evidence-based practice. While CNSs may engage in some administrative tasks, their primary focus is on clinical expertise and improving the quality and safety of patient care. This approach dilutes the core clinical focus of the CNS role and may not align with regulatory definitions of advanced practice. A further incorrect approach defines the CNS role narrowly as a consultant to other nurses, neglecting the direct patient care and system-level improvement aspects. While consultation is a component, it is not the sole or defining characteristic of the CNS scope. This limited view fails to encompass the multifaceted nature of the CNS role as a change agent and leader in healthcare. Professional reasoning. Professionals should approach defining their scope of practice by first consulting the relevant State Nurse Practice Act and any accompanying regulations or advisory opinions. This is the primary legal document defining the boundaries of practice. Currently, they should refer to National Professional Organizations' position statements and scope of practice documents, e.g., those from the Clinical Nurse Specialist Australia or relevant U.S. nursing bodies, for best practice guidance and a comprehensive understanding of the role's potential. A critical step is to then apply these frameworks to their specific work environment, considering organizational policies and the needs of the patient population they serve. This integrated approach ensures practice is both legally compliant and professionally advanced, leading to optimal patient outcomes. Question 4. Process analysis reveals that a clinical nurse specialist, CNS, is evaluating their advanced physical examination skills in the context of diagnosing a complex, multi-system condition. Which of the following approaches best reflects a commitment to best practice and professional accountability in this evaluation? Option A. The CNS focuses on correlating subjective patient reports with objective findings from a comprehensive, systematic physical examination, utilizing current evidence-based techniques. Option B. The CNS relies primarily on the patient's description of symptoms, assuming that their self-reporting accurately reflects the underlying pathology. Option C. The CNS prioritizes completing the physical examination as quickly as possible to maximize patient throughput. Option D. The CNS utilizes examination techniques that were taught during their initial nursing education, without seeking updates on newer methodologies. The correct answer is A. The CNS focuses on correlating subjective patient reports with objective findings from a comprehensive, systematic physical examination, utilizing current evidence-based techniques. Explanation. Scenario analysis. This scenario presents a professional challenge for a clinical nurse specialist, CNS, in advanced physical examination skills due to the inherent complexity of diagnosing subtle, early-stage conditions. The CNS must integrate a broad knowledge base with refined psychomotor skills and critical thinking to differentiate between normal variations and pathological findings. The pressure to provide accurate diagnostic information for timely and effective patient care, while adhering to professional standards and scope of practice, necessitates meticulous evaluation of examination techniques. Correct approach analysis. The correct approach involves a systematic, evidence-based evaluation of the CNS's advanced physical examination skills, focusing on the application of specific techniques and their correlation with diagnostic accuracy. This aligns with the core competencies expected of a CNS, emphasizing the integration of advanced practice knowledge with clinical judgment. Best professional practice dictates that the evaluation should be grounded in established nursing standards of practice and scope of practice guidelines, ensuring that the assessment methods are valid, reliable, and contribute to optimal patient outcomes. This approach upholds the ethical obligation to provide competent and safe care, as mandated by professional nursing organizations and regulatory bodies governing advanced practice nursing. Incorrect approach is analysis, an approach that relies solely on subjective patient reports without objective physical findings fails to meet the standards of advanced physical examination, potentially leading to misdiagnosis and inappropriate treatment. This neglects the fundamental principle of objective assessment in nursing practice and violates the ethical duty to provide evidence-based care. An approach that prioritizes speed over thoroughness in the examination process is also professionally unacceptable. Advanced physical examination requires meticulous attention to detail and a comprehensive assessment to identify subtle signs and symptoms. Rushing the process increases the risk of overlooking critical findings, which constitutes a breach of the professional standard of care and an ethical failure to protect patient well-being. An approach that uses outdated or unvalidated examination techniques without consideration for current best practices or evidence is similarly problematic. Professional nursing practice demands continuous learning and the adoption of current, evidence-based methodologies. Reliance on outdated practices can lead to inaccurate assessments and compromises patient safety, violating the ethical imperative for competence and professional development. Professional reasoning. Professionals should employ a decision-making framework that prioritizes patient safety and evidence-based practice. This involves 1. Understanding the scope of practice and adhering to established standards. 2. Utilizing a systematic and comprehensive approach to assessment. 3. Critically evaluating findings in the context of the patient's history and presentation. 4. Continuously seeking to enhance knowledge and skills through education and professional development. 5. Collaborating with interdisciplinary teams when necessary to ensure optimal patient care. Question 5. Assessment of a patient's comprehensive health status is a core responsibility of the clinical nurse specialist. During a scheduled assessment, a patient expresses significant discomfort and reluctance to proceed with a portion of the physical examination, citing a desire for privacy and a general feeling of unease. The CNS recognizes the importance of a complete assessment for accurate diagnosis and treatment planning, but also acknowledges the patient's right to autonomy and dignity. What is the most ethically and professionally sound approach for the CNS to take in this situation? Option A. Proceed with the full physical examination as planned, as the CNS's professional duty to assess outweighs the patient's current expressed discomfort. Option B. Gently explain the importance of the complete assessment for their safety and well-being, explore the specific reasons for their discomfort, and collaboratively determine if parts of the assessment can be modified, postponed, or conducted with alternative approaches that respect their boundaries while still gathering essential information. Option C. Persuade the patient by emphasizing the potential negative consequences of an incomplete assessment and the risks associated with withholding information, even if it means overriding their immediate feelings of unease. Option D. Immediately cease the assessment and document the patient's refusal without further attempt to understand their concerns or explore alternative strategies to avoid causing further distress. Correct answer is B. Gently explain the importance of the complete assessment for their safety and well-being, explore the specific reasons for their discomfort, and collaboratively determine if parts of the assessment can be modified, postponed, or conducted with alternative approaches that respect their boundaries while still gathering essential information. Explanation. Scenario analysis. This scenario presents a professional challenge due to the inherent conflict between a patient's expressed desire for privacy and the clinical nurse specialist's (CNS) ethical and professional obligation to conduct a comprehensive health assessment to ensure patient safety and optimal care. The CNS must navigate the patient's autonomy and right to refuse certain aspects of an assessment against the potential risks of incomplete data, which could lead to adverse outcomes. This requires a delicate balance of communication, respect, and clinical judgment, adhering strictly to professional standards and patient rights. Correct approach analysis. The correct approach involves a multifaceted strategy that prioritizes patient autonomy while still striving for a comprehensive assessment. This includes open and honest communication with the patient about the purpose and importance of the assessment, explaining how the information will be used to benefit their care, and exploring the underlying reasons for their reluctance. Offering alternatives, such as performing the assessment in stages or focusing on specific areas initially, demonstrates respect for their boundaries and can build trust. Documenting the patient's refusal and the rationale for it, along with any alternative strategies employed, is crucial for legal and ethical accountability. This approach aligns with the core principles of patient-centered care, beneficence, and non-maleficence, as well as the ethical guidelines governing professional nursing practice, which emphasize informed consent and respect for patient values. Incorrect approaches analysis. One incorrect approach involves proceeding with the full assessment without adequately addressing the patient's concerns or obtaining their consent. This violates the patient's right to autonomy and informed consent, which are fundamental ethical and legal principles in healthcare. It can erode trust, lead to patient distress, and potentially result in legal repercussions for the CNS and the healthcare institution. Another incorrect approach is to abandon the comprehensive assessment entirely based on the initial reluctance without further exploration or negotiation. While respecting patient refusal is paramount, a CNS has a professional responsibility to advocate for the patient's well-being. Simply discontinuing the assessment without attempting to understand the barriers or find alternative solutions could be considered a failure of professional duty and potentially lead to misdiagnosis or suboptimal care, thus violating the principle of beneficence. A third incorrect approach is to coerce or pressure the patient into agreeing to the assessment. This is ethically indefensible and constitutes a violation of patient rights. Coercion undermines the therapeutic relationship and can lead to significant psychological harm to the patient. It directly contravenes the ethical imperative to respect patient dignity and self-determination. Professional reasoning. Professionals should employ a decision-making process that begins with active listening and empathetic communication to understand the patient's perspective. This involves exploring the reasons behind their reluctance, validating their feelings, and clearly explaining the rationale and benefits of the assessment. The next step is to collaboratively problem-solve, offering options and compromises that respect the patient's boundaries while still aiming to gather essential health information. This might involve prioritizing certain aspects of the assessment, breaking it down into smaller, more manageable parts, or scheduling it at a later time. Throughout this process, meticulous documentation of all communication, patient decisions, and actions taken is essential for accountability and continuity of care. This systematic approach ensures that patient rights are upheld while fulfilling the professional obligation to provide safe and effective care. Question 6. Comparative studies suggest that while randomized controlled trials offer the highest level of evidence for intervention effectiveness, their implementation in acute care settings can be challenging. A clinical nurse specialist is tasked with evaluating a novel, evidence-based pain management protocol designed to reduce opioid use and improve patient satisfaction in a surgical unit. Considering the ethical imperative to provide optimal care to all patients and the practical constraints of a busy hospital environment, which research methodology would best balance the need for rigorous evaluation with clinical feasibility and ethical considerations in the United States? Option A. A descriptive study observing pain levels and patient satisfaction scores before and after the protocol's implementation without a control group. Option B. A retrospective chart review of patients who have already received the new protocol, analyzing their pain scores and satisfaction data. Option C. A randomized controlled trial where patients are randomly assigned to either the new protocol or standard care, with strict adherence to randomization protocols. Option D. A quasi-experimental design utilizing a non-equivalent control group, comparing outcomes between patients receiving the new protocol and a matched group receiving standard care. The correct answer is D. A quasi-experimental design utilizing a non-equivalent control group, comparing outcomes between patients receiving the new protocol and a matched group receiving standard care. Explanation. This scenario presents a common challenge for clinical nurse specialists, CNS, in the United States, where they are expected to lead evidence-based practice initiatives. The core of the challenge lies in selecting the most appropriate research methodology to evaluate the effectiveness of a new pain management protocol in a diverse patient population within a hospital setting. This requires a deep understanding of research designs, their strengths, limitations, and their alignment with regulatory and ethical standards governing patient care and research in the U.S. The CNS must balance the need for rigorous evidence with the practical constraints of a clinical environment, ensuring patient safety and data integrity. The correct approach, a quasi-experimental design with a control group, represents best professional practice because it allows for the evaluation of the intervention's impact while acknowledging the ethical and practical limitations of true randomization in a busy clinical setting. This design, such as a non-equivalent control group design, can provide strong evidence of causality by comparing outcomes between a group receiving the new protocol and a comparable group not receiving it, while controlling for confounding variables as much as possible. This aligns with the principles of evidence-based practice mandated by professional nursing organizations and regulatory bodies like the Joint Commission, which emphasize the use of the best available evidence to improve patient outcomes. The ethical imperative to provide the best possible care to all patients, even those in the control group, is also addressed by ensuring the control group receives standard of care, which is ethically sound. An incorrect approach would be to use a purely descriptive study. This fails to establish causality and cannot definitively determine if the new protocol is effective. Ethically, relying solely on descriptive data to implement a new protocol could lead to the adoption of an ineffective intervention, potentially compromising patient care and wasting resources. Another incorrect approach would be a randomized controlled trial, RCT, without careful consideration of feasibility and ethical implications in a real-world clinical setting. While RCTs are the gold standard for establishing causality, forcing randomization in a busy hospital might be logistically impossible, ethically problematic if it means withholding a potentially beneficial intervention from a control group without strong justification, and could lead to significant bias if not implemented perfectly. This could violate principles of beneficence and non-maleficence if the randomization process disrupts care, or if the control group is demonstrably disadvantaged. A retrospective chart review, while potentially easier to conduct, suffers from similar limitations to descriptive studies regarding causality and is prone to significant recall bias and data incompleteness, failing to meet the rigor required for evidence-based practice implementation. The professional decision-making process for similar situations should involve a systematic approach. First, clearly define the clinical question and the desired outcomes. Second, review the existing literature to understand current best practices and identify knowledge gaps. Third, consider the feasibility of different research designs within the clinical context, including ethical considerations, patient population characteristics, and available resources. Fourth, select the design that offers the strongest evidence of causality while remaining ethically sound and practically achievable. Finally, implement the chosen methodology with rigorous attention to data collection, analysis, and interpretation, ensuring that findings are translated into improved patient care in accordance with U.S. healthcare regulations and nursing ethics. Question 7. Performance analysis shows a concerning trend in near-miss medication events related to polypharmacy in elderly patients. As a clinical nurse specialist, what is the most effective approach to proactively mitigate future medication-related risks within this patient population? Option A. Conduct a comprehensive risk assessment of the entire medication management system, from prescribing and dispensing to administration and patient education, identifying systemic vulnerabilities and potential failure points. Option B. Initiate a performance improvement project focused on retraining all nursing staff involved in medication administration on proper dosage calculations and drug-to-drug interaction checks. Option C. Implement a mandatory, organization-wide policy requiring a second nurse to verify all medications administered to patients aged 65 and older, regardless of the medication's risk profile. Option D. Analyze all reported near-miss medication events from the past year to identify common themes and develop targeted educational materials for staff. The correct answer is A. Conduct a comprehensive risk assessment of the entire medication management system, from prescribing and dispensing to administration and patient education, identifying systemic vulnerabilities and potential failure points. Explanation. Scenario analysis. This scenario is professionally challenging because it requires the clinical nurse specialist, CNS, to balance patient safety with the practical realities of medication administration in a complex healthcare environment. The CNS must identify systemic risks that could lead to medication errors, which can have severe patient consequences. This necessitates a proactive and analytical approach to risk assessment, moving beyond individual error reporting to understand underlying system vulnerabilities. Correct approach analysis. A comprehensive risk assessment that analyzes medication management processes from procurement to administration and monitoring is the best professional practice. This approach aligns with the core principles of patient safety and quality improvement mandated by regulatory bodies overseeing advanced practice nursing. By systematically evaluating each stage, potential failure points can be identified before they lead to adverse events. This aligns with the CNS's role in system-level change and evidence-based practice, aiming to prevent errors rather than solely react to them. This proactive stance is ethically imperative, as it prioritizes patient well-being and adheres to the professional obligation to maintain a safe healthcare environment. Incorrect approaches analysis, focusing solely on individual staff performance without investigating systemic factors, is an ethical and regulatory failure. This approach blames individuals rather than identifying and correcting flawed processes, which is a fundamental principle of patient safety initiatives, can lead to a culture of fear and underreporting, hindering genuine improvement. Implementing a new medication administration technology without a thorough pre-implementation risk assessment and staff training is a significant regulatory and ethical lapse. This can introduce new, unforeseen risks and may not address the root causes of existing medication management issues. It fails to meet the standard of due diligence in adopting new practices. Conducting a retrospective review of reported medication errors without a forward-looking risk assessment of the entire medication management system is insufficient. While reviewing past errors is valuable, it does not proactively identify potential future risks or systemic weaknesses that have not yet resulted in reported errors. This reactive approach misses opportunities for preventative action. Professional reasoning. Professionals should employ a systematic, multifaceted approach to risk assessment in medication management. This involves 1. Understanding the entire medication lifecycle within the organization. 2. Utilizing data from various sources, incident reports, audits, patient feedback, direct observation. 3. Engaging interdisciplinary teams in the assessment process. And 4. Prioritizing interventions based on the potential severity and likelihood of harm. The CNS should champion a culture of safety, where open reporting is encouraged and used for learning and system improvement, rather than punitive action. Question 8. To address the challenge of managing common chronic and acute conditions across diverse populations, which approach best reflects the core competencies and ethical obligations of a clinical nurse specialist? Option A. Prioritizing interventions based on the most recent evidence-based guidelines, while also conducting a comprehensive assessment to tailor care to the individual's unique physiological, psychosocial, and environmental context. Option B. Relying on personal clinical experience and anecdotal evidence to guide treatment decisions, without consulting current research or established protocols. Option C. Focusing primarily on managing acute exacerbations of illness, assuming that chronic conditions will be managed by primary care physicians. Option D. Implementing a standardized protocol for all patients with a specific diagnosis, regardless of individual circumstances or preferences. The correct answer is D. Implementing a standardized protocol for all patients with a specific diagnosis, regardless of individual circumstances or preferences. Explanation. This scenario presents a professional challenge due to the inherent complexity of managing chronic and acute conditions across diverse patient populations, each with unique physiological, psychosocial, and environmental factors influencing their health outcomes. A clinical nurse specialist, CNS, must possess a comprehensive understanding of these conditions and the ability to tailor interventions to meet the specific needs of individuals, families, and communities. Careful judgment is required to prioritize care, allocate resources effectively, and advocate for evidence-based practices that promote optimal health and prevent complications. The correct approach represents best professional practice because it emphasizes a holistic, patient-centered strategy that integrates evidence-based guidelines with individualized care planning. This aligns with the core tenets of advanced nursing practice, which mandate the application of scientific knowledge and clinical expertise to improve patient outcomes. Specifically, this approach adheres to the ethical principles of beneficence and non-maleficence by ensuring that interventions are both beneficial and minimize harm. It also reflects the professional responsibility to promote patient autonomy and dignity by involving patients in their care decisions. Regulatory frameworks for CNS practice, such as those outlined by the American Nurses Credentialing Center, (ANC), for the CNSC certification, underscore the importance of population-specific health promotion and disease management, requiring CNSs to demonstrate competence in assessing health needs, developing and implementing care plans, and evaluating outcomes across various age groups and health statuses. An incorrect approach that focuses solely on acute symptom management without addressing the underlying chronic disease burden fails to meet the comprehensive care standards expected of a CNS. This approach risks exacerbating the chronic condition, leading to increased hospitalizations, reduced quality of life, and higher healthcare costs. Ethically, it violates the principle of beneficence by not providing the most beneficial care. From a regulatory standpoint, it falls short of the expectation for advanced practice nurses to manage the full spectrum of a patient's health needs. Another incorrect approach that relies exclusively on anecdotal evidence or personal experience, disregarding current research and evidence-based guidelines, is professionally unacceptable. This practice can lead to suboptimal or even harmful interventions, as it lacks the rigor and validation provided by scientific inquiry. It violates the professional obligation to provide care that is supported by the best available evidence, as mandated by professional nursing organizations and regulatory bodies. Such an approach also undermines patient safety and trust. A third incorrect approach that neglects the psychosocial and environmental determinants of health, focusing only on the biological aspects of disease, is also flawed. Chronic and acute conditions are often deeply intertwined with a patient's social support, economic status, cultural beliefs, and living environment. Failing to consider these factors limits the effectiveness of interventions and can perpetuate health disparities. This approach is ethically problematic as it fails to address the whole person and can lead to inequitable care. It also contravenes regulatory expectations for a comprehensive assessment and care plan that considers all relevant patient factors. The professional decision-making process for similar situations should involve a systematic approach. First, conducting a thorough assessment that encompasses biological, psychological, social, and environmental factors. Second, identifying the patient's primary concerns and goals. Third, consulting evidence-based guidelines and research to inform potential interventions. Fourth, collaborating with the patient, family, and interdisciplinary team to develop a personalized care plan. And fifth, continuously evaluating the effectiveness of interventions and making necessary adjustments. This iterative process ensures that care is patient-centered, evidence-based, and responsive to the evolving needs of individuals across diverse populations. Question 9. The monitoring system demonstrates a consistent decline in the adherence to a newly implemented evidence-based protocol for postoperative pain management, with a significant number of patients reporting inadequate pain relief despite receiving prescribed analgesia. As a clinical nurse specialist, what is the most appropriate initial course of action to address this discrepancy and advocate for improved patient outcomes? Option A. Immediately escalate the issue to hospital administration, highlighting the non-compliance with the protocol and requesting disciplinary action for staff who are not following it. Option B. Consult with the medical staff leadership to discuss the observed non-compliance and request that they enforce the protocol through physician orders, assuming the issue lies primarily with physician prescribing patterns. Option C. Conduct direct observations of nursing practice on the relevant units, interview frontline nurses to identify perceived barriers to protocol adherence, and gather data on patient satisfaction with pain management. Option D. Initiate a mandatory, one-time in-service education session for all nursing staff on the importance of the pain management protocol, without further investigation into current practices. The correct answer is C. Conduct direct observations of nursing practice on the relevant units, interview frontline nurses to identify perceived barriers to protocol adherence, and gather data on patient satisfaction with pain management. Explanation. The monitoring system demonstrates a consistent pattern of underutilization of a new evidence-based protocol for managing a specific chronic condition. This scenario is professionally challenging because it requires the clinical nurse specialist, CNS, to navigate complex systemic barriers, advocate for patient well-being, and uphold professional standards of care, all while respecting the existing organizational structure and the autonomy of other healthcare professionals. The CNS must balance the imperative to improve patient outcomes with the practical realities of healthcare delivery. The correct approach represents best professional practice because it directly addresses the identified gap in care through a systematic, data-driven, and collaborative strategy. By initiating a review of the monitoring data, engaging with frontline staff to understand barriers, and developing targeted educational interventions, the CNS is actively advocating for patients by ensuring they receive the most effective care. This aligns with the CNS's role as a leader in quality improvement and evidence-based practice, as outlined by professional standards that emphasize the CNS's responsibility to influence practice and improve patient outcomes. This approach respects the principles of ethical practice by prioritizing patient welfare and promoting a culture of continuous learning and improvement within the healthcare system. An incorrect approach that focuses solely on reporting the data to upper administration without first investigating the root causes of underutilization fails to address the problem effectively. This approach may be perceived as punitive rather than supportive, potentially alienating frontline staff and hindering future collaborative efforts. It neglects the ethical obligation to understand and mitigate barriers to optimal care. Another incorrect approach, which involves bypassing frontline staff and implementing mandatory training without understanding their perspectives, disregards the importance of interprofessional collaboration and may lead to resistance and ineffective adoption of the protocol. This approach fails to acknowledge the expertise and experience of the nurses delivering care and can undermine their professional judgment. A third incorrect approach, which involves accepting the current practice without further investigation due to perceived resistance from physicians, represents a failure of advocacy. The CNS has a professional and ethical responsibility to champion evidence-based practices that benefit patients, even when faced with potential interprofessional conflict. This approach prioritizes expediency over patient well-being and abdicates the CNS's leadership role in quality improvement. The professional decision-making process for similar situations should involve a systematic approach. First, identify the problem using objective data. Second, investigate the underlying causes through direct observation and communication with those involved. Third, develop collaborative solutions that are evidence-based and contextually appropriate. Fourth, implement interventions with ongoing evaluation and refinement. And finally, advocate for systemic changes that support best practices. This process emphasizes data-driven decision-making, interprofessional collaboration, and a commitment to patient advocacy. Question 10. System analysis indicates a consistent pattern of delayed discharge for patients with complex chronic conditions, leading to increased length of stay and patient dissatisfaction. As a clinical nurse specialist, what is the most effective approach to optimize this care process? Option A. Focus on individual patient education during hospitalization, assuming that improved patient understanding will naturally expedite discharge. Option B. Delegate the responsibility of identifying and resolving discharge delays to the bedside nursing staff without providing additional resources or structured support. Option C. Rely on personal clinical experience and intuition to suggest immediate changes to the discharge process without formal data collection or research. Option D. Initiate a comprehensive review of current discharge planning protocols. Collect data on patient demographics and contributing factors to delays, and collaborate with interdisciplinary teams to develop and implement evidence-based interventions, followed by ongoing outcome evaluation. Correct answer is D. Initiate a comprehensive review of current discharge planning protocols. collect data on patient demographics and contributing factors to delays, and collaborate with interdisciplinary teams to develop and implement evidence-based interventions, followed by ongoing outcome evaluation. Explanation. Scenario analysis. This scenario presents a common challenge for clinical nurse specialists, CNS, in optimizing care processes. Core difficulty lies in balancing the CNS's multifaceted roles, clinician, educator, consultant, researcher, and leader, to achieve tangible improvements in patient outcomes and system efficiency. The CNS must leverage their expertise to identify a problem, analyze its root causes, develop evidence-based interventions, and implement these changes across a complex healthcare system, all while navigating organizational dynamics and resource constraints. This requires a strategic, systematic, and collaborative approach. Correct approach analysis. The correct approach emphasizes the CNS's role as a researcher and leader, initiating a systematic process to identify a specific, measurable problem, e.g., increased readmission rates for a particular diagnosis. This involves data collection and analysis to understand the current state and identify gaps. Subsequently, the CNS acts as a clinician and educator by developing evidence-based interventions, which are then disseminated and implemented through their consultant and leadership roles. This approach aligns with the CNS's responsibility to advance nursing practice and improve patient care through scientific inquiry and system-level change, as supported by core competencies in evidence-based practice and leadership within the CNSC framework. The focus on data-driven decision-making and measurable outcomes is paramount. Incorrect approaches analysis. One incorrect approach might involve the CNS solely acting as a clinician, focusing on individual patient care without addressing the systemic issues contributing to the problem. This fails to leverage the CNS's broader roles in education, consultation, research, and leadership, thus not optimizing the process for a wider patient population or the healthcare system. It represents a failure to engage in system-level improvement, a key responsibility of the CNS. Another incorrect approach could be to rely solely on anecdotal evidence or personal experience to propose solutions. This bypasses the critical researcher role, which mandates the use of evidence-based practice. Without a foundation in research and data analysis, proposed interventions may be ineffective or even harmful, violating ethical obligations to provide safe and quality care, and potentially contravening guidelines that emphasize evidence-based practice. A third incorrect approach might be to delegate the entire process to frontline staff without adequate support, education, or a clear leadership framework. While collaboration is essential, the CNS's leadership and consultative roles require them to guide, mentor, and facilitate the change process. Abdicating this responsibility neglects the CNS's mandate to influence and improve practice across the organization. Professional reasoning. Professionals should approach process optimization by first identifying a specific data-supported problem. This is followed by a thorough root cause analysis, leveraging research skills. Next, evidence-based interventions are developed, drawing on clinical expertise and consultation. Implementation requires leadership and educational strategies, with ongoing evaluation to ensure sustained improvement. This systematic, multi-role approach ensures that interventions are effective, sustainable, and aligned with professional standards and patient needs. Question 11. The assessment process reveals a patient with newly diagnosed heart failure experiencing significant peripheral edema and dyspnea. The clinical nurse specialist is considering initiating pharmacological management. Which of the following pharmacological approaches best addresses the underlying disease process and patient safety within the scope of advanced practice nursing in the U.S.? Option A. Administering a beta blocker to reduce cardiac workload without first assessing the patient's current ejection fraction or hemodynamic stability. Option B. Prescribing a loop diuretic, such as furosemide, after assessing renal function and electrolyte levels, with a plan for close monitoring of fluid balance and electrolyte status. Option C. Initiating an angiotensin-converting enzyme ACE inhibitor without evaluating for potential contraindications like angioedema or hyperkalemia. Option D. Recommending a high-dose opioid analgesic to manage the patient's dyspnea, bypassing a thorough assessment of the underlying cause of respiratory distress. Correct answer is B. Prescribing a loop diuretic such as furosemide after assessing renal function and electrolyte levels, with a plan for close monitoring of fluid balance and electrolyte status. Explanation. The assessment process reveals a patient with newly diagnosed heart failure experiencing significant edema and dyspnea. The clinical nurse specialist, CNS, is tasked with recommending a pharmacological intervention. This scenario is professionally challenging because the choice of medication must consider not only the immediate symptoms, but also the underlying pathophysiology of heart failure, potential drug interactions, patient comorbidities, and the specific regulatory guidelines governing advanced practice nursing in the U.S. for prescribing and managing such conditions. The CNS must demonstrate a deep understanding of pharmacodynamics and pharmacokinetics in the context of a complex disease process, adhering strictly to the Nurse Practice Act and relevant state and federal regulations for CNS practice. The correct approach involves a comprehensive assessment of the patient's cardiac function, renal status, electrolyte balance, and current medication list. Based on this, the CNS would select a diuretic that effectively reduces fluid overload while minimizing adverse effects, such as electrolyte imbalances or worsening renal function. This approach aligns with the CNS's role in evidence-based practice and patient advocacy, ensuring the safest and most effective therapeutic outcome within the scope of practice defined by the American Association of Colleges of Nursing, ACN, Essentials and State Nurse Practice Acts. The selection of a medication would be guided by current clinical practice guidelines for heart failure management, such as those from the American Heart Association/American College of Cardiology, AHA/AC, and would involve careful consideration of the patient's individual response and tolerance. An incorrect approach would be to select a medication based solely on symptom relief, without a thorough understanding of its impact on the underlying disease process or potential contraindications. For instance, prescribing a potent diuretic without monitoring electrolytes could lead to hypokalemia, exacerbating cardiac arrhythmias, a direct violation of the standard of care, and potentially a breach of professional duty. Another incorrect approach would be to prescribe a medication outside the scope of practice as defined by the state's Nurse Practice Act, which could result in legal and ethical repercussions, including disciplinary action by the State Board of Nursing. Failing to document the rationale for medication selection and the patient's response thoroughly would also be a regulatory and ethical failure, hindering continuity of care and accountability. Professional decision-making in such situations requires a systematic approach. 1. Thorough patient assessment. 2. Identification of the primary pharmacological problem, e.g., fluid overload and heart failure. 3. Consideration of evidence-based treatment options within the CNS's scope of practice. 4. Evaluation of patient-specific factors, comorbidities, allergies, current medications. 5. Selection of the most appropriate intervention with a clear rationale. 6. Implementation of the intervention. And 7. Ongoing monitoring and evaluation of the patient's response and potential adverse effects. This iterative process ensures patient safety and adherence to regulatory and ethical standards. Question 12. Consider a scenario where a clinical nurse specialist, CNS, has identified compelling evidence from multiple high-quality systematic reviews and meta-analyses supporting a new approach to managing a specific chronic condition that demonstrably improves patient outcomes and reduces healthcare costs. However, the current institutional protocol for this condition has been in place for several years and is widely followed by the nursing staff. Though it is not based on the most recent evidence, the CNS believes strongly that adopting the new evidence-based approach is critical for optimal patient care. What is the most appropriate course of action for the CNS to take in this situation? Option A. Immediately begin educating staff on the new evidence and encouraging them to adopt the new approach in their practice, bypassing formal protocol review to expedite patient benefit. Option B. Continue to advocate for the new approach based on personal conviction and the strength of the evidence, but accept the current protocol if institutional resistance to change is encountered, prioritizing harmony over evidence-based advancement. Option C. Implement the new approach directly by updating the institutional protocol without further consultation or pilot testing, assuming the evidence is sufficient justification for immediate widespread adoption. Option D. Initiate a formal process to critically appraise the new evidence, assess its applicability to the patient population, and develop a proposal for a pilot study or phased implementation of the new approach, involving key stakeholders and seeking institutional approval. Correct answer is D. Initiate a formal process to critically appraise the new evidence, assess its applicability to the patient population, and develop a proposal for a pilot study or phased implementation of the new approach, involving key stakeholders and seeking institutional approval. Explanation. This scenario presents a common challenge in evidence-based practice (EP), where a clinical nurse specialist (CNS) must balance the integration of new, robust evidence with the practical realities of a healthcare setting, including existing protocols and staff acceptance. The professional challenge lies in advocating for change based on superior evidence, while respecting the established order and ensuring patient safety and optimal outcomes. Careful judgment is required to navigate potential resistance, resource limitations, and the need for a systematic approach to implementation. The correct approach represents best professional practice because it prioritizes a systematic, evidence-driven process for evaluating and integrating new knowledge. This aligns with the core tenets of EBP, which mandate the conscientious, explicit, and judicious use of current best evidence in making decisions about the care of individual patients. It involves critically appraising research, considering patient values and preferences, and incorporating clinical expertise. Furthermore, this approach respects the established governance structures within a healthcare organization, ensuring that changes are vetted, approved, and implemented in a way that is sustainable and safe. This systematic evaluation and phased implementation is crucial for demonstrating the efficacy and safety of the proposed change, thereby increasing the likelihood of successful adoption and positive patient outcomes, which is a fundamental ethical and professional obligation. An incorrect approach that relies solely on personal conviction or anecdotal evidence fails to meet the rigorous standards of EBP. This approach bypasses the critical appraisal of research, which is a cornerstone of evidence-based decision-making. Ethically, it risks implementing interventions that may not be effective or could even be harmful, violating the principle of non-maleficence. Regulatory frameworks for nursing practice, including those governing CNS roles, emphasize the use of current, evidence-based knowledge to guide practice. Relying on outdated protocols without critical reevaluation, even if they are institutional policy, can be a failure to adhere to professional standards if superior evidence exists and has not been considered. Another incorrect approach that focuses on immediate implementation without adequate stakeholder buy-in or a pilot study neglects the practical aspects of change management and patient safety. While the evidence may be strong, a hasty, uncoordinated rollout can lead to errors, staff confusion, and resistance, ultimately undermining the intended benefits. This approach can be seen as a failure to adequately assess the feasibility and potential impact of the change within the specific clinical context, which is an integral part of EBP implementation. It may also violate organizational policies regarding protocol changes and quality improvement initiatives, which often require a structured approach to ensure patient safety and resource allocation. The professional decision-making process for similar situations should involve a structured EBP model. This typically includes 1. Asking a clinical question, 2. Acquiring the best evidence, 3. Appraising the evidence, 4. Applying the evidence, and 5. Evaluating the outcomes. For CNS, this also involves understanding the organizational context, identifying key stakeholders, building consensus, and developing a plan for dissemination and integration that considers feasibility, cost-effectiveness, and potential barriers to adoption. This systematic and collaborative approach ensures that changes are not only evidence-based, but also practical, safe, and sustainable, ultimately benefiting patients and the healthcare system. Question 13. The investigation demonstrates a patient with chronic inflammatory bowel disease experiencing significant symptom burden, including pain, fatigue, and anxiety, despite optimal conventional medical management. The CNS is considering integrating complementary therapies to address the patient's holistic needs. Which of the following approaches best aligns with the CNS's role in optimizing care through integrative strategies, considering the patient's complex pathophysiology? Option A. Suggesting the patient discontinue all conventional medications in favor of a purely naturalistic approach to healing, as advocated by a popular wellness influencer online. Option B. Implementing a standardized protocol for aromatherapy using lavender oil for all patients experiencing anxiety, irrespective of their specific medical conditions or individual preferences. Option C. Developing a personalized care plan that incorporates evidence-based integrative modalities such as mindfulness-based stress reduction for anxiety and fatigue, acupuncture for pain management, and dietary modifications guided by a registered dietitian specializing in gastrointestinal health. following a thorough assessment of the patient's current condition and potential contraindications. Option D. Recommending a specific herbal supplement known for its anti-inflammatory properties, based on anecdotal reports from a patient support group, without further investigation into its efficacy or potential interactions with the patient's current medications. The correct answer is D. Recommending a specific herbal supplement known for its anti-inflammatory properties, based on anecdotal reports from a patient support group, without further investigation into its efficacy or potential interactions with the patient's current medications. Explanation: the investigation demonstrates a complex patient scenario where a clinical nurse specialist, CNS, must integrate various therapeutic modalities to address multifaceted pathophysiology. This scenario is professionally challenging due to the need to synthesize evidence-based practices across different domains of care, ensuring patient safety and optimizing outcomes, while adhering to the scope of practice and regulatory guidelines for CNSs in the United States. The CNS must navigate potential interactions between therapies, consider individual patient responses, and maintain a holistic perspective that honors the patient's values and preferences. The correct approach represents best professional practice because it prioritizes a comprehensive, individualized assessment and the synergistic application of evidence-based integrative therapies. This aligns with the CNS's role in advancing patient care through expert clinical practice, consultation, education, and research, as outlined by the American Association of Colleges of Nursing, AACN Essentials for Advanced Practice Nursing. Specifically, it emphasizes a thorough understanding of the pathophysiology of the patient's condition and how each integrative modality, when applied judiciously, can address specific physiological and psychological aspects of the illness experience. This approach respects the patient as a whole person, acknowledging the interconnectedness of mind, body, and spirit, and promotes a collaborative decision-making process with the patient and interdisciplinary team. An incorrect approach that solely focuses on a single integrative modality, without a thorough assessment of the patient's overall pathophysiology, fails to meet the comprehensive standards of advanced practice nursing. This could lead to suboptimal outcomes or even adverse events if the chosen modality is not appropriate for the patient's specific condition, or if it interacts negatively with other treatments. Ethically, this represents a failure to provide patient-centered care and to utilize the full scope of the CNS's expertise. Another incorrect approach that relies on anecdotal evidence or unproven therapies without a strong scientific or regulatory basis, e.g., not recognized by established professional bodies or lacking robust research, violates the principle of evidence-based practice. This poses a significant risk to patient safety and undermines the credibility of the CNS and the profession. Regulatory frameworks in the U.S., such as those governing advanced practice registered nurses, mandate that care be based on current scientific knowledge and evidence. A third incorrect approach that neglects to consider potential contraindications or interactions between integrative therapies and conventional medical treatments is a critical regulatory and ethical failure. The CNS has a responsibility to ensure the safety and efficacy of all interventions. Failure to do so can result in harm to the patient, violating the fundamental ethical principle of non-maleficence and potentially contravening state nurse practice acts and Board of Nursing regulations. The professional decision-making process for similar situations should involve a systematic approach. 1. Comprehensive assessment of the patient's pathophysiology, comorbidities, and psychosocial factors. 2. Thorough review of the evidence supporting various integrative modalities for the specific condition. 3. Consideration of potential interactions and contraindications with existing treatments. 4. Collaborative discussion with the patient and interdisciplinary team to develop a shared plan of care. 5. Ongoing evaluation of the patient's response to interventions and adjustment of the plan as needed, always adhering to professional standards and regulatory requirements. Question 14. Upon reviewing the pharmacokinetic and pharmacodynamic profile of a newly prescribed medication for a patient with multiple comorbidities and polypharmacy, what is the most appropriate risk assessment approach for the clinical nurse specialist to employ to ensure optimal therapeutic outcomes and patient safety? Option A. Prioritize immediate symptom relief by titrating the medication aggressively, deferring detailed interaction assessments until later. Option B. Rely primarily on standard dosing guidelines and package insert information, assuming typical patient responses. Option C. Conduct a comprehensive risk assessment that integrates patient-specific factors, drug properties, and potential interactions to anticipate and mitigate adverse drug events. Option D. Defer all medication management decisions to the prescribing physician, offering no independent clinical judgment or recommendations. The correct answer is C. Conduct a comprehensive risk assessment that integrates patient-specific factors, drug properties, and potential interactions to anticipate and mitigate adverse drug events. Explanation. The scenario presents a common clinical challenge where a clinical nurse specialist, CNS, must interpret complex pharmacokinetic and pharmacodynamic principles to optimize patient care, specifically concerning a new medication with a narrow therapeutic index. The challenge lies in balancing efficacy with the risk of adverse events, requiring a nuanced understanding of how the drug interacts with the patient's unique physiology and other medications. This necessitates a risk assessment approach that prioritizes patient safety and evidence-based practice, aligning with the core competencies expected of a CNS. The correct approach involves a comprehensive risk assessment that integrates patient-specific factors, drug properties, and potential interactions to anticipate and mitigate adverse drug events. This aligns with the CNS's role in promoting safe and effective medication management, a fundamental aspect of quality patient care. Regulatory frameworks and professional guidelines emphasize the importance of individualized patient care and the CNS's responsibility to advocate for patient safety through informed clinical decision-making. This approach ensures that interventions are evidence-based and tailored to the patient's needs, minimizing harm and maximizing therapeutic benefit. An incorrect approach would be to solely rely on standard dosing guidelines without considering individual patient variables. This fails to acknowledge the inherent variability in drug absorption, distribution, metabolism, and excretion, which can significantly impact drug response and increase the risk of toxicity or subtherapeutic effects. Ethically, this approach breaches the principle of beneficence by not acting in the patient's best interest and potentially violates the principle of non-maleficence by exposing the patient to unnecessary risks. Regulatory failure would stem from not adhering to standards of care that mandate individualized patient assessment and management. Another incorrect approach would be to prioritize rapid symptom relief over a thorough assessment of potential long-term consequences or drug interactions. While immediate symptom management is important, a CNS must consider the broader implications of pharmacotherapy, including cumulative effects, organ function, and potential for drug resistance. This approach neglects the principle of prudence and foresight, potentially leading to iatrogenic harm. A third incorrect approach would be to defer decision-making entirely to the prescribing physician without offering expert clinical judgment. While collaboration is essential, the CNS's role includes providing expert consultation and contributing to the development of evidence-based treatment plans. Abdicating this responsibility would be a failure to utilize their specialized knowledge and skills, potentially compromising patient care and not fulfilling their professional mandate. The professional reasoning process for similar situations should involve a systematic evaluation of the patient's condition, the pharmacology of the prescribed medication, and the patient's individual characteristics. This includes reviewing the patient's medical history, current medications, laboratory values, and any known allergies or sensitivities. The CNS should then apply principles of pharmacokinetics and pharmacodynamics to predict the likely drug response and potential adverse effects. This information should be used to inform a risk assessment, leading to the development of a safe and effective medication management plan, which may include recommendations for monitoring, dose adjustments, or alternative therapies. Collaboration with the interdisciplinary team is crucial throughout this process. Question 15. Benchmark analysis indicates that a clinical nurse specialist is developing a patient education plan for a newly prescribed complex medication regimen. Which of the following approaches best aligns with current best practices for promoting medication adherence within the U.S. regulatory and ethical framework for advanced practice nursing? Option A. Provide the patient with a standard, detailed pamphlet on the medication and instruct them to read it thoroughly before their next appointment. Option B. Conduct a comprehensive assessment of the patient's health literacy, cultural background, and potential barriers to adherence, Then develop a personalized, multimodal educational strategy incorporating teach-back methods to confirm understanding. Option C. Ask the patient if they understand the medication instructions and assume comprehension if they verbally agree. Option D. Focus solely on explaining the mechanism of action and potential side effects of the medication, assuming the patient will manage practical adherence issues independently. The correct answer is B. Conduct a comprehensive assessment of the patient's health literacy, cultural background, and potential barriers to adherence, then develop a personalized, multimodal educational strategy incorporating teach-back methods to confirm understanding. Explanation. Scenario analysis. This scenario presents a common yet complex challenge for clinical nurse specialists, CNS, in the United States, as they are tasked with ensuring patients understand and adhere to their medication regimens. The challenge lies in tailoring education to individual patient needs, considering their health literacy, cultural background, cognitive abilities, and socioeconomic factors, all while operating within the scope of practice defined by state nurse practice acts and federal regulations like HIPAA. Effective patient education is not merely information delivery. It's a process of empowering patients to actively participate in their care, which directly impacts health outcomes and reduces healthcare costs associated with non-adherence. Correct approach analysis. The correct approach emphasizes a personalized, multimodal educational strategy that assesses patient understanding and barriers to adherence. This aligns with the American Nurses Association ANA Code of Ethics, which mandates that nurses advocate for their patients and provide competent, compassionate care. Specifically, Provision 5 states that the nurse owes the same duties to self as to others, including the responsibility to promote an environment that supports safe, effective, quality patient care. This translates to individualized education plans that address the patient's unique situation. Federal guidelines, such as those from the Agency for Healthcare Research and Quality (AHQ), highlight the importance of teach-back methods and involving patients in decision-making to improve adherence. This approach respects patient autonomy and promotes self-management, which are core tenets of patient-centered care and are implicitly supported by the CNSC certification's focus on advanced practice and evidence-based intervention. Incorrect approaches analysis. Providing a generic, one-size-fits-all pamphlet without assessing comprehension fails to meet the standard of individualized care and violates the ethical principle of beneficence, as it does not actively promote the patient's well-being. This approach also neglects the legal and ethical obligation to ensure patients can understand and act upon health information, potentially leading to adverse events and noncompliance, which could be viewed as a breach of the nurse's duty of care. Relying solely on the patient's self-reported understanding without employing objective verification methods like teach-back is insufficient. Patients may overestimate their comprehension due to a desire to please the healthcare provider or a lack of awareness of their own knowledge gaps. This can lead to a false sense of security regarding adherence and a failure to identify and address underlying barriers, thus not fulfilling the CNS's role in optimizing patient outcomes. Focusing exclusively on the pharmacological aspects of the medication and neglecting the patient's lifestyle, beliefs, and potential barriers to adherence is an incomplete educational strategy. Effective medication education requires a holistic approach that considers the patient's entire context, as mandated by the biopsychosocial model of health prevalent in nursing practice. This narrow focus can lead to missed opportunities to address practical challenges that impede adherence, such as cost, side effects, or complex dosing schedules. Professional reasoning. When faced with a patient education scenario, a CNS should first conduct a thorough assessment of the patient's health literacy, cultural beliefs, learning style, and any identified barriers to medication adherence. This assessment informs the development of a personalized education plan. The plan should incorporate multiple teaching methods, such as verbal explanations, written materials in appropriate language and literacy levels, visual aids, and demonstration. Crucially, the effectiveness of the education must be evaluated using teach-back methods to confirm patient understanding. The CNS should also explore and address any identified barriers collaboratively with the patient, involving other healthcare professionals or resources as needed. This iterative process of assessment, intervention, and evaluation ensures that education is effective, patient-centered, and promotes optimal health outcomes, adhering to professional standards and ethical obligations. Question 16. Examination of the data shows a significant increase in hospital-acquired infections, high, related to central venous catheter, CVC, insertion in the intensive care unit, ICU. Current practice involves a standardized insertion kit, but lacks a mandatory checklist for all steps of the insertion process, and adherence to aseptic technique appears variable among staff. Evidence-based guidelines strongly recommend a comprehensive CVC insertion checklist and strict adherence to aseptic technique to reduce HAIs. As the clinical nurse specialist for critical care, what is the most appropriate initial approach to address this issue? Option A. Develop and implement a mandatory CVC insertion checklist. Provide comprehensive education to all ICU nursing staff on its use and aseptic technique, and initiate a pilot program to evaluate its impact on HAI rates. Option B. Compile a report detailing the current practice's deficiencies and present it to hospital administration, requesting immediate disciplinary action for staff not adhering to best practices. Option C. Immediately mandate the use of a new, evidence-based CVC insertion protocol for all staff, bypassing current physician and nursing leadership for immediate implementation. Option D. Conduct a series of educational sessions for nursing staff on the latest evidence for CVC insertion, focusing on aseptic technique, without directly addressing the lack of a checklist or physician involvement. The correct answer is A. Develop and implement a mandatory CVC insertion checklist. Provide comprehensive education to all ICU nursing staff on its use and aseptic technique, and initiate a pilot program to evaluate its impact on HAI rates. Explanation. This scenario presents a common challenge for clinical nurse specialists, CNS, involving the integration of evidence-based practice into a complex organizational system. The CNS must navigate established protocols, physician preferences, and the practical realities of nursing workflow while advocating for improved patient outcomes. The core of the challenge lies in balancing the imperative for evidence-based change with the need for stakeholder buy-in and sustainable implementation. The correct approach represents best professional practice because it aligns with the CNS's core competencies of expert clinical practice, consultation, education, and research. By initiating a systematic review of current practice against established evidence, engaging key stakeholders, physicians, nursing staff, administration, and developing a pilot program, the CNS demonstrates a comprehensive and collaborative strategy. This approach respects the existing structure while systematically introducing and evaluating change, ensuring that interventions are not only evidence-based, but also feasible and effective within the specific organizational context. This aligns with the ethical principles of beneficence, promoting patient well-being and non-maleficence, avoiding harm by implementing unproven or disruptive practices without due diligence. Furthermore, it adheres to professional standards that emphasize the CNS's role in driving quality improvement through evidence translation. An incorrect approach that involves unilaterally implementing the new protocol without consultation or pilot testing would represent a significant ethical and regulatory failure. This bypasses essential steps in change management, potentially alienating the medical staff and nursing team, leading to resistance and undermining the credibility of the CNS and the evidence itself. It could also violate organizational policies regarding protocol changes and potentially lead to patient safety issues if the new protocol is not adequately understood or supported by the frontline staff. Another incorrect approach, focusing solely on educating staff without addressing the underlying physician practice patterns or administrative support, would likely result in limited adoption and sustainability. This fails to address the systemic barriers to change and overlooks the CNS's role in influencing practice at multiple levels. Finally, an approach that dismisses the current practice as simply outdated, without a thorough understanding of the reasons for its persistence or the potential challenges of implementation, risks alienating key personnel and failing to achieve meaningful, lasting change. This demonstrates a lack of nuanced understanding of organizational dynamics and the complexities of healthcare change. Professional decision-making in such situations requires a systematic process. First, identify the problem and the evidence supporting a change. Second, assess the organizational context, including existing practices, potential barriers, and key stakeholders. Third, develop a strategic plan for implementation that includes education, consultation, and evaluation. Fourth, engage stakeholders collaboratively throughout the process. And fifth, monitor outcomes and adapt the plan as needed. This iterative and collaborative approach ensures that evidence-based practice is integrated effectively and sustainably, ultimately benefiting patient care. Question 17. Performance analysis shows a recurring pattern of delayed communication and conflicting approaches among the interprofessional team caring for complex patients, leading to patient care inefficiencies and occasional misunderstandings. The clinical nurse specialist, CNS, observes that the physician often makes unilateral decisions regarding treatment adjustment without fully consulting the nursing staff or physical therapy, and the nursing staff feels their input is not consistently valued. What is the most effective process optimization strategy for the CNS to address this interprofessional collaboration challenge? Option A. The CNS should schedule a dedicated meeting with the physician to discuss the observed communication gaps and collaboratively develop strategies for improved interprofessional dialogue and shared decision-making, emphasizing the impact on patient outcomes. Option B. The CNS should focus on strengthening the nursing team's communication skills and assertiveness training to better advocate for their input during patient care discussions. Option C. The CNS should initiate a facilitated interprofessional team meeting involving the physician, nursing staff, physical therapy, and other relevant disciplines to openly discuss communication challenges, identify root causes, and collaboratively develop a shared plan for enhanced teamwork and communication protocols. Option D. The CNS should document the physician's actions in the patient's medical record and report the concerns to hospital administration, requesting administrative intervention to enforce better communication practices. The correct answer is A. The CNS should schedule a dedicated meeting with the physician to discuss the observed communication gaps and collaboratively develop strategies for improved interprofessional dialogue and shared decision-making, emphasizing the impact on patient outcomes. Explanation. Scenario analysis. This scenario presents a common challenge in healthcare where a clinical nurse specialist, CNS, must navigate differing communication styles and priorities among interprofessional team members to ensure optimal patient care. The CNS's role as a leader and advocate requires them to facilitate effective collaboration, which is crucial for patient safety and positive outcomes, as emphasized by core competencies for advanced practice registered nurses. The challenge lies in balancing the need for immediate action with the importance of fostering a cohesive and respectful team environment, all while adhering to established healthcare protocols and ethical guidelines. Correct approach analysis. The most effective approach involves the CNS initiating a structured, facilitated discussion. This aligns with the CNS's responsibility to promote evidence-based practice and improve patient outcomes through interprofessional collaboration. By bringing all relevant parties together, the CNS can ensure all perspectives are heard, identify the root cause of the communication breakdown, and collaboratively develop a unified plan. This process respects the expertise of each team member and promotes shared decision-making, which is a cornerstone of effective teamwork, and is implicitly supported by regulatory frameworks that emphasize patient-centered care and interdisciplinary communication. This approach optimizes process by addressing the systemic issue of communication rather than just the immediate symptom. Incorrect approach is analysis. One incorrect approach is for the CNS to unilaterally implement a change based on their own assessment without broader team input. This bypasses the collaborative process, potentially alienating other team members and undermining their professional autonomy and expertise. It fails to address the underlying interprofessional dynamics and could lead to resistance or a lack of buy-in, ultimately hindering long-term process improvement. This approach risks violating ethical principles of respect for persons and professional collaboration. Another incorrect approach is to address the issue solely with the physician, excluding other key team members. This creates a siloed communication pattern, reinforcing the very interprofessional disconnect the CNS aims to resolve. It fails to acknowledge the contributions and perspectives of nurses, therapists, or other allied health professionals who are integral to the patient's care plan. This approach is ethically problematic as it does not promote equitable participation and can lead to fragmented care. A third incorrect approach is to ignore the conflict and hope it resolves itself. This passive stance abdicates the CNS's leadership responsibility and allows a dysfunctional team dynamic to persist. This inaction can directly compromise patient safety and quality of care, as miscommunication and lack of coordination can lead to errors. Ethically, this is a failure to act in the best interest of the patient and to uphold professional standards of teamwork and advocacy. Professional reasoning. When faced with interprofessional conflict impacting patient care, a CNS should employ a systematic problem-solving approach. This involves 1. Recognizing and validating the issue. 2. Gathering information from all involved parties to understand their perspectives and the impact on patient care. 3. Facilitating a structured, neutral discussion to identify the root cause of the conflict and explore potential solutions. 4. Collaboratively developing and implementing a mutually agreed-upon plan of action. 5. Evaluating the effectiveness of the implemented solutions and making adjustments as needed. This process ensures that patient needs remain paramount while fostering a supportive and effective interprofessional environment. Question 18. The performance metrics show a consistent trend of registered nurses demonstrating suboptimal skills in advanced clinical assessment, leading to potential delays in identifying critical patient changes. As a clinical nurse specialist, what is the most appropriate initial course of action to address this identified performance gap? Option A. Initiate disciplinary review for registered nurses who are identified as consistently underperforming in their assessment documentation. Option B. Delegate the responsibility for developing and delivering advanced assessment training to the unit managers without direct clinical nurse specialist oversight. Option C. Immediately implement a mandatory, standardized online training module on basic assessment techniques for all registered nurses to ensure a foundational understanding. Option D. Conduct a comprehensive needs assessment to identify specific areas of deficit in advanced clinical assessment skills among registered nurses, followed by the development and implementation of targeted, evidence-based educational interventions and a plan for ongoing evaluation. The correct answer is D. Conduct a comprehensive needs assessment to identify specific areas of deficit in advanced clinical assessment skills among registered nurses, followed by the development and implementation of targeted, evidence-based educational interventions and a plan for ongoing evaluation. Explanation. Scenario analysis. This scenario presents a common challenge for clinical nurse specialists, CNS, where performance data highlights a gap in advanced clinical assessment skills among registered nurses, RN. The professional challenge lies in identifying the root cause of this deficit and implementing an effective, evidence-based intervention that aligns with professional standards and regulatory expectations for advanced practice nursing. The CNS must balance the need for immediate improvement with the long-term goal of enhancing the overall quality of patient care and ensuring compliance with nursing practice acts and core competencies. Correct approach analysis. The correct approach involves a multifaceted strategy that begins with a thorough needs assessment to understand the specific deficits in advanced clinical assessment. This is followed by the development and implementation of targeted educational interventions, such as workshops and simulation-based training, that are tailored to the identified needs. Crucially, this approach includes ongoing evaluation of the effectiveness of these interventions through continued performance monitoring and feedback mechanisms. This aligns with the CNS role as an expert clinician, educator, and leader, promoting evidence-based practice and professional development as mandated by the CNSC certification standards, which emphasize the CNS's responsibility for improving patient outcomes through the application of advanced nursing knowledge and skills. Incorrect approaches analysis. One incorrect approach focuses solely on punitive measures or disciplinary action without addressing the underlying educational needs. This fails to uphold the ethical principle of beneficence and violates the CNS's role as an educator and advocate for professional growth. It also overlooks the regulatory requirement to support and develop nursing staff. Another incorrect approach involves implementing generic, one-size-fits-all training that does not address the specific assessment deficits identified in the performance metrics. This is inefficient, potentially ineffective, and does not demonstrate the critical thinking and evidence-based practice expected of a CNS. It may also lead to frustration and disengagement among the RNs. A third incorrect approach might involve delegating the entire responsibility for addressing the assessment gap to other staff without direct CNS involvement or oversight. This abdicates the CNS's core responsibilities for leadership, education, and quality improvement, and fails to leverage their specialized expertise in advanced clinical assessment. It also bypasses the regulatory expectation for advanced practice nurses to lead and influence practice. Professional reasoning. Professionals should approach this situation by first acknowledging the data and its implications for patient care. The next step is to engage in a systematic process of inquiry, starting with a detailed needs assessment to pinpoint the exact nature of the assessment deficits. This should be followed by the collaborative development of a targeted, evidence-based intervention plan. Implementation should be accompanied by robust evaluation and iterative refinement of the strategy. This decision-making process emphasizes data-driven practice, professional accountability, and a commitment to continuous improvement, all of which are central to the CNSC role. Question 19. Analysis of a clinical nurse specialist's approach to health history taking for a patient presenting with acute shortness of breath and a known history of multiple chronic conditions, considering the need for immediate intervention versus comprehensive data collection. What is the most appropriate initial strategy for gathering essential health history information? Option A. Rely exclusively on the information available in the patient's electronic health record, assuming it is complete and accurate, and defer direct patient questioning until the patient is more stable. Option B. Immediately request a complete, detailed medical history from the patient covering all past illnesses, surgeries, and hospitalizations, regardless of their apparent relevance to the current complaint. Option C. Focus primarily on the patient's current vital signs and physical examination findings, postponing any detailed health history taking until after initial medical stabilization has been achieved. Option D. Begin by thoroughly exploring the chief complaint of shortness of breath, including onset, duration, character, aggravating and alleviating factors, and associated symptoms, before proceeding to a targeted review of systems and relevant past medical, surgical, family, and social history. The correct answer is D. Begin by thoroughly exploring the chief complaint of shortness of breath, including onset, duration, character, aggravating and alleviating factors, and associated symptoms, before proceeding to a targeted review of systems and relevant past medical, surgical, family, and social history. Explanation. Scenario analysis. This scenario presents a common challenge for clinical nurse specialists, CNS, in a U.S. healthcare setting, balancing the need for comprehensive health history taking with the practical constraints of time and patient acuity. The CNS must gather sufficient information to inform their advanced practice role, which includes diagnosis, treatment, and consultation, while also respecting the patient's comfort and the healthcare system's efficiency. The challenge lies in identifying the most critical components of the health history that are essential for the CNS's scope of practice, particularly when faced with a patient who is experiencing acute distress and has a complex past medical history. The CNS's judgment is crucial in prioritizing information gathering without compromising the quality of care or patient safety. Correct approach analysis. The correct approach involves a systematic and prioritized method of health history taking, focusing on the chief complaint and its associated symptoms, followed by a targeted review of systems and relevant past medical, surgical, family, and social history. This aligns with the American Nurses Association, ANA, standards of practice for clinical nurse specialists, which emphasize the importance of comprehensive assessment and data collection. Specifically, Standard 1, Assessment, mandates that the CNS collects health data in a comprehensive and systematic manner, using appropriate assessment techniques. By beginning with the chief complaint and then delving into related areas, the CNS ensures that the most pressing issues are addressed first, while also building a foundational understanding of the patient's overall health status. This approach is efficient, patient-centered, and ethically sound, as it respects the patient's immediate needs while fulfilling the professional obligation to gather necessary information for effective care planning and intervention. Documentation must be accurate, thorough, and reflect the data collected and the rationale for clinical judgments, adhering to facility policies and state nursing practice acts. Incorrect approaches analysis. One incorrect approach would be to solely focus on the patient's immediate, acute symptoms without exploring the broader context of their health history. This could lead to a superficial understanding of the patient's condition, potentially missing crucial contributing factors or comorbidities that could impact diagnosis and treatment. This fails to meet the comprehensive data collection requirement of the ANA standards of practice and could result in suboptimal patient outcomes. Another incorrect approach would be to attempt to gather an exhaustive, detailed history of every single past medical issue, regardless of its relevance to the current presentation, before addressing the chief complaint. This would be inefficient, potentially overwhelming for an acutely ill patient, and could delay necessary interventions. While thoroughness is important, it must be balanced with clinical judgment and prioritization, as mandated by the principles of advanced practice nursing. This approach also risks violating the ethical principle of beneficence by prolonging the patient's discomfort unnecessarily. A third incorrect approach would be to rely solely on existing electronic health records (EHR) without direct patient interview or validation. While EHRs are valuable resources, they may contain outdated or incomplete information, and they cannot replace the nuanced understanding gained through direct patient interaction. The CNS has a professional responsibility to validate information and gather subjective data directly from the patient, as outlined in assessment standards. Failure to do so could lead to diagnostic errors and compromised care, violating the duty of care. Professional reasoning. Professionals should employ a decision-making framework that prioritizes patient safety and well-being while adhering to professional standards. This involves 1. Initial assessment of the patient's immediate condition and level of distress. 2. Prioritization of data collection based on the chief complaint and potential impact on immediate care. 3. Systematic exploration of relevant health history components, moving from broad to specific as indicated. 4. Continuous evaluation of the patient's tolerance for the interview and adjustment of the approach as needed. 5. Accurate and timely documentation that reflects the assessment findings and clinical reasoning. This framework ensures that care is both comprehensive and responsive to the patient's evolving needs. Question 20. Governance review demonstrates a need to enhance the competency of the nursing staff in managing complex wound care. The clinical nurse specialist, CNS, is tasked with developing an educational program. Which approach to assessing the learning needs and styles of the nursing staff would be most effective and compliant with professional standards for developing this program? Option A. Distributing a standardized online questionnaire to all nursing staff asking them to rate their confidence in various wound care procedures and to select their preferred learning style from a predefined list. Option B. Relying solely on the results of a recent facility-wide knowledge assessment on wound care principles to identify areas for improvement and assuming a uniform learning style among staff. Option C. Conducting individual interviews with a representative sample of nurses to discuss their perceived challenges in wound care and their preferred learning methods, supplemented by a review of recent wound care-related incident reports. Option D. Asking nurse managers to provide a general overview of their team's wound care knowledge gaps without direct engagement with the staff nurses themselves. The correct answer is C. Conducting individual interviews with a representative sample of nurses to discuss their perceived challenges in wound care and their preferred learning methods, supplemented by a review of recent wound care-related incident reports. Explanation. Scenario analysis. This scenario is professionally challenging because the clinical nurse specialist, CNS, must navigate diverse learning needs and styles within a group of healthcare professionals, each with varying levels of experience, prior education, and preferred methods of knowledge acquisition. Effective needs assessment is foundational to developing targeted and impactful educational interventions, ensuring that learning is not only delivered but also retained and applied, ultimately impacting patient care quality and safety. Failure to accurately assess these needs can lead to ineffective education, wasted resources, and a lack of buy-in from the learners. Correct approach analysis. The correct approach involves a multifaceted assessment that utilizes a combination of direct observation, individual interviews, and a review of existing performance data or incident reports. This comprehensive strategy allows the CNS to triangulate information, gaining a holistic understanding of the learning gaps, preferred learning modalities, e.g., visual, auditory, kinesthetic reading/writing, and the contextual factors influencing learning. This aligns with the core principles of adult learning theory and best practices in nursing education, emphasizing learner-centered approaches. Specifically, the CNS's role in promoting evidence-based practice and improving patient outcomes necessitates educational strategies that are tailored to the specific needs of the target audience, as mandated by professional nursing standards and regulatory bodies that emphasize continuous quality improvement and professional development. Incorrect approaches analysis. An approach that relies solely on a single method, such as a generic pretest or a broad survey without follow-up, is insufficient. Pretest may identify knowledge deficits, but does not reveal learning styles or preferred methods of instruction. A generic survey might yield superficial data that doesn't capture the nuances of individual learning preferences or the specific barriers to learning within the clinical environment. Relying solely on self-reported learning styles without corroborating evidence can also be misleading, as individuals may not accurately perceive their own optimal learning methods. These approaches fail to meet the professional obligation to conduct a thorough and accurate needs assessment, which is a prerequisite for effective educational planning and implementation, potentially leading to noncompliance with standards for continuing education and professional development that require demonstrable impact. Professional reasoning. Professionals should employ a systematic and iterative process for assessing learning needs. This begins with defining the overarching learning objectives and then identifying the target audience. Subsequently, a variety of assessment methods should be employed, including but not limited to direct observation of practice, structured interviews with learners and their supervisors, analysis of performance metrics and quality improvement data, and the use of validated questionnaires or surveys that explore both knowledge gaps and learning preferences. The data gathered should then be synthesized to inform the design of educational interventions that are relevant, engaging, and effective for the specific learner population. Regular evaluation of the educational outcomes should also inform future needs assessments, creating a continuous improvement loop.